Lots of questions about the different vaccines and what you can do to get your shot. To help us go over the latest on the vaccine rollout in Wisconsin, we're joined again by Dr. Jeff Pothof from UW Health. Dr. Pothof, it's good to see you again. So what are you telling people who are hesitant about getting the vaccine?
Yeah, I think, when we first started doing the vaccine rollout, we did have large studies, but now fast forward a few months, we now have, tens to hundreds of millions of people around the world vaccinated with these vaccines. And what we saw in the studies is holding true. These vaccines are not only incredibly effective, they're very safe. And as we saw from the CDC guidance, they are the key to getting life back to normal, with those who are fully vaccinated now being allowed to gather in private residences.
This week, we're going to see the J&J vaccine available in Wisconsin. That would make 3 shots available. Of course, the J&J, the big difference there is that it's a 1 dose. So people are going to say, especially if they're looking for options here, what is the best one for them? We even heard the mayor in Detroit say he didn't think J&J was the best for his city. So what do you tell people who are going to be doing some brand shopping here?
Yeah, the answer to that is simple. Get whichever one you can find first. And the reason for that is when we look at efficacy, or what you've heard, that, J&J is in the 60%, Pfizer and Moderna 95%. And that's true for developing any symptoms. But if we look at what really matters, symptoms that land you in a hospital or disease so severe it kills you, all 3 of these vaccines protect against that. So I'd get the first one that I could find and walk away with a smile.
So what are the public health consequences of people refusing to get vaccinated? We know that some people are, let's say they're sort of saying they're going to run out the clock here. They're going to say, I'm going to wait for herd immunity. Then I won't have to worry about getting a vaccine because most people will have it.
Right. So, I hear people saying, I'm just going to wait for enough people to get it where I'm protected via herd immunity. The truth of it is we're kind of in a race against the clock. The virus right now is mutating, and it's possible that if enough people don't get vaccinated and continue to spread the virus between each other, a mutation will develop that will then be resistant to our vaccines, and we start all over again. So it's really important for us to get vaccinated so we don't give the virus an opportunity to mutate and defeat our current vaccines.
Just a few seconds left. What do you see as herd immunity? Is that about 70%?
70 to 80%, depending on how easy it is for the predominant strain to transmit to different people. But 70 to 80% is probably where we're looking.
All right, Dr. Jeff Pothof, again, we thank you for your time.